This will be a very brief discussion or a presentation on the system we have in the U.S. And Dr. Helmer and I are here together from the VA in the U.S. And we're not here as official representatives of the VA. We both do clinical work, so we see veterans day in and day out. So my description of our system are just my own opinions, my own descriptions, but it's very important to us how our organization is structured so that we can do the clinical work that we do. So basically, I'm thinking about what Neil was talking about with the British system. We have a mixed system in the US. And as I said yesterday, about of the 22 million veterans that, that we have in the US, about 6 or 7 million are seen through the VA, the Department of Veterans Affairs. So that means almost half of our veterans are seen in the private sector. So you can see that for us, we need to have a mixed system that works to meet the needs of our veterans. For me personally, recently there's been kind of a push towards more private-based care, and it's called Choice. In fact, we have a program called Choice, which allows veterans to be seen anywhere they need to be seen or want to be seen in the community. And what we found is, for some veterans, that's a great deal. And I see veterans in the state of Washington that live out on the Olympic Peninsula in rural areas. They love being able to go to a local doctor, and it's really good for them to be able to go to a local doctor. What we also find, though, is that about half of the veterans that get some of their care in the private sector get some of their care also from the VA. So the way our VA is structured, and we started offering support for veterans after the Revolutionary War in 1776. So all the way along, we have given support of different sorts to veterans. In 1930, finally, they decided to have a Department of Veterans Affairs. So what we have now is a Department of Veterans Affairs that's a cabinet-level office. So there's the Secretary of Defense, there's a Secretary of State, there's a Secretary of Education, and there's a Secretary of the VA. So at that level, we have what would be considered you know, that sort of a structure for our VA, a cabinet-level position. And the Secretary of the VA is on what's kind of considered the political side of the VA because they're political appointees. On kind of the administrative and actual administering of the VA, it's under the Undersecretary of the VA. And that tends to be the person that more hands-on runs the VA, whereas the Secretary sort of sets the course for the VA, and that's a political appointment. So the Department of Veterans Affairs has a Veterans Health Administration for health care, and that's like yesterday, 150 hospitals, several thousand healthcare teams. That is our healthcare arm. There's the Veterans Benefits Administration, which is for, it has several lines of business: home loans, insurance, vocational rehab and employment, education, and compensation and pension is under this Veterans Benefit Administration. There's the Health Administration for healthcare, the Benefits Administration for benefits, and then there's the National Cemetery Association. So the thing I like about this is it reminds us that veterans need health care, they need other sorts of support, and they need the honor due to them for the service that they've given. So that's kind of the way our VA is structured. So I don't know that I need to say anything more than that, although, again, these are my personal opinions. There are some advantages of having real choice for the veterans. In other words, they can come to the VA or they can see someone in the private sector. Many veterans do better in the VA than they would in the private sector. In some, it's vice versa. So I like the idea that we have a mixed system. Recently, we started sending people out to the community for pain care, and there's a lot of problems with opioids among veterans in the US in general, opioid problems. What we found is that if we sent veterans who had mental health issues out to the community for pain care, they actually ended up doing more poorly than if they came to the VA. So I guess bottom line is whatever is decided here in Ukraine, or whatever we decide anywhere, hopefully we're doing whatever is necessary to make sure that veterans get the best health care possible. So that's what we're trying to do in the VA, and we continue to adjust our system to try to make it more effective in taking care of our veterans using a mixed model.